Hey guys, welcome once again to Mondays with Marty. My name's Cassie, and this is my dog Marty. And today we're actually going to talk about flea and tick prevention because flea and tick season is quickly approaching. Now, it's good to use a flea and tick medication or prevention all year round, but especially come spring when everything starts waking up. So, the first thing to think about when considering a flea and tick prevention is species. So make sure you're picking a dog medication for dogs and a cat medication for cats. And this is really important because there's actually some, with dog medication, especially the topical, cats, that can actually be harmful or even fatal to your cats. There's just some of the drugs that are acceptable for dogs are not safe for cats. So making sure you pick a dog version for a dog and a cat version for a cat. And also, if you have a dog and a cat that are particularly bonded to the point where the cat will actually groom the dog, it's probably better for you to stay away from topical in general for your dog, just because you don't want the cat licking the topical medication off of your dog, because again, it could be pretty harmful for your cat with them being groomers. So that might be a good option for an oral medication for that dog. Once you've got your species established, there's a couple different styles or types of medication or prevention. One is topical. Topical is pretty commonly used, honestly, for most dogs. It comes in a little box like this. There's different dosages, so you could have a four dose, you can have 2 dose. Each dose generally lasts for about a month. And when you go to apply it, it's a little tube. Come here, buddy. And you just apply it across their top line. The best place to do it really is here on the shoulders. Obviously, you have to follow the label recommendation, but you also want to put it in a place on your dog where your dog's not going to be able to lick it off. So shoulder blades are pretty great for that as well. But again, make sure you're following the label. And then make sure you also are picking out the right size for your dog. So with this one, it's 21 to 55 pounds. It is pretty important that the dosage matches the size of the dog. You would not want to use this on a little dog because it just wouldn't be good for them. Additionally, a lot of these aren't going to be appropriate for puppies. Most are going to be 7 weeks or older just because puppies are more sensitive. They bite each other. So make sure if you have a puppy in a house with a multi-dog household, as long as you treat all of your other dogs, your puppy should be okay until he's old enough, or he or she is old enough that you can use a topical medication or prevention. There are also collars that are generally going to be good for several months. There's different options for these collars. We sell them. And in regards to collars, just make sure that you're buying them from a reputable source, because there are a lot of knockoff collars that are available online that are not well regulated, so they can cause issues for your dog. And if you did want to try a collar, just keep an eye on your dog when you're first introducing them to it. So look at their skin around their neck and just make sure they're not reacting at all, because there is some possibility of that happening. And if you start to see a reaction, take the collar off right away and talk to your vet. But collars are great for people who have trouble remembering to apply a flea and tick medication every month. I am definitely guilty of that, but I've never used collars just because I don't like leaving a collar on my dog 24/7. That's just my personal preference. And then there are also oral medications. So it's essentially just a little tablet that you feed to your dog. That's actually the option that I use with Marty. Downside is you can only buy those through a vet because it is a prescription. But I prefer to use that with him just because he has so much hair that I am concerned that a topical medication such as this wouldn't get through to his skin, because that's important with the topical medications, is you do get skin contact because their skin absorbs the chemicals. If you don't get it all the way to their skin, if it just stays on their hair coat, which would probably happen with Marty, it just wouldn't be as effective. So I do use an oral medication with him. My German short hair pointer, I use topical because she has such short hair that I'm not too worried about it getting down through. The topicals do have an oil-based, I can't even think of the word right now, but essentially the active ingredient is mixed in with an oil-based carrier, and that will leave some residue on your dog's top line where you have applied it, which I also don't want on Marty just because I don't bathe him that often, and I don't want to have to worry about cleaning that off after a couple days because it'll take a little while for that to kind of dry off. So those are your options: topical, collar, and oral medication. So then the next thing to look at is drug class. So there are two main drug classes. A fipronil base, which this one is essentially what Frontline is. So this is the generic version, but fipronil and then methoprene are the active ingredients in that. And then with Advantix, it's going to be imidacloprid and permethrin, as well as one other active ingredient that I'm not going to try and pronounce. But those are your two different options, and they just have different modes of action, so they help control fleas in different ways. So, for example, the nice thing about the fipronil is it does tend to be a little cheaper than the Advantix or the generics. However, if you've been using fipronil and you just don't think it's working as well, you are seeing some fleas and just aren't super confident in it, just switch drug classes. Again, different modes of action. So there has been some demonstration of fleas developing a slight resistance to fipronil, so switch to the Advantix and it'll help a lot. That being said, if you do have a flea infestation, which it literally happens to everybody, it's just a problem. It's very important that you not only treat the dog or your cat, but you also have to treat the environment. So all of the pets in your house need to be treated, as well as cleaning all of the dog's bedding, all of your bedding, in hot water with soap, and then dry everything on the highest setting. A really strong vacuum, if you can steam clean your house, that's really helpful. We also have different sprays that you can use throughout your house, powders, foggers. You have to treat the entire environment because a lot of the flea's lifespan is actually not on the host. So when you see the flea on the host, that's when they're a full-on adult. But the eggs and the larvae and the cocoons, those are in the environment. So you might control the adults, and then in a couple weeks, you see them again. Well, that's because the round of eggs just hatched. So it is really important to control all of the areas in addition to all of the pets. Outdoors, it's a little more challenging. However, there are some different solutions for treating some of the areas your pets spend time in outside, but that's where it's really valuable to use a preventative versus having to treat it, because treating is a pain and takes some real effort. It can be done, but it does take some effort. And if you see fleas, some signs that you do have some fleas are your pets will just itch a lot. And if it's, you can look and see if it's dry, flaky skin. If it's not dry, flaky skin, and you start to see some flea dirt, which is also flea manure, some good places to see it here. I'll see if he'll roll over for me. Can you roll it? Good boy. So he's not gonna go over, but between their back legs is a really great place to see flea dirt. It's just little flecks of brown dirt, and that's kind of where they like to hang out because they like dark and safe and protected. So their back legs, and honestly, you can see fleas. They're little black specks that do move, so you can see them on your dogs. First-hand experience, you can see fleas. So pulling them off, we also do have flea shampoos if you do find fleas on your dog, and kennel dips. So there are different options out there for fleas. Ticks are a little more manageable than fleas just because they don't infest the environment like fleas do, and they also, once they're on your dog, they're generally going to be stationary. Fleas jump around. They're kind of hard to catch. Ticks latch on and feed off of your dog. That being said, ticks can carry some pretty nasty stuff, especially with us being kind of a Lyme hotspot. So tick prevention is pretty important as much as possible. And with long-haired dogs, it's a lot harder to find them. And that's where some routine grooming does come in handy, because you're just getting your hands and brushes up in your dog's fur, so it helps to find those things. But that's flea and tick. If you have any questions, feel free to drop them in the comments. But also, use your vet, because they're going to be the best resource for handling flea and tick issues as well. So if you have any questions, again, drop them in the comments. And thanks for tuning in. We'll see you in 2 weeks.